Hello friends, today we will discuss about what is the difference between initial, subsequent encounter and sequela ICD-10 codes. Since the injury codes have been categorized into initial, subsequent encounter and sequela, many coders have confusion in coding the initial, subsequent encounter codes as well as the sequela ICD-10 codes. And the things which are there are separate categories like which in scenarios where we can use initial codes and where we can use the subsequent encounter. So let us check how we can differentiate between initial and subsequent encounter first. So first we'll check about initial encounter. Initial encounters are when the patient is receiving the active treatment for the injury or the adverse effects of the drugs or chemicals. So for the initial encounter we have to use the seventh character as A. So below are the some examples as per 3M where we can consider as active treatment for initial encounter, like for surgical treatment and emergency department encounter, continuation of IV antibiotic administration, wound VAC dressing changes, evaluation and continuing treatment by the same or different physician can be considered as still an active treatment and can be given as initial encounter in such cases. And continuation for active treatment includes transfer for a long time care facility and receive the same treatment or when it is in the acute care facility. So in these scenarios we can code the initial encounter code as the code. Do not get confused with this number of visits because for initial encounter number of visits doesn't matter. Till the active treatment is going on we can code the initial encounter code. Subsequent encounter we have to use the subsequent encounter character 7 character as D when the active treatment of the injury has been provided and has been completed. So use subsequent encounter for encounters after the active treatment for the injury has been provided and receiving the routine care during the healing or the recovery phase. So example of subsequent care will be cast adjustment, change, removal or wedging, external or internal fixation removal, follow-up visits following fracture treatment, medication adjustment, rehabilitation services, routine dressing change, suture removal, wound check, x-ray to check the healing status of fracture, other aftercare and follow-up visit following injury treatment. For aftercare acute injury code with 7 character, use D as the 7th character and assign only D as the 7th character. For initial encounter we have to use A, and for subsequent we have to use D as 7th character. Do not use any Z code for the aftercare injury code because here subsequent encounter itself represent that it is under aftercare. So let us move to the final one, the sequela. Sequela encounters. Sequela codes will be having the 7 character as S, and sequela are used for complications or conditions that arise as a direct result of an injury. Example, the scar formation after a wound. So here use the both injury code with 7 character as that precipitate the sequela and the code for the sequela itself. 7 character as identified that the injury responsible for the sequela. So the specific type of sequela example scar is sequence first followed by the injury code. So as per the below example you can see the paralysis of right wrist due to previous accidental self-inflicted laceration of right return. So here G56.31 is given as the primary code for the specific type of sequela, followed by the injury code for the laceration as 64.21xs with the 7th character S with the external injury code X58 XXX. So here two codes we have coded as per the coding guideline. First one with the sequela is sequence a specific type of sequela is sequence first followed by the injury code with the 7 characters. Hope you have cleared your confusion regarding coding initial encounter, subsequent encounter, and sequela. If you have any confusion, do give your feedback in the comment section, and if you like the video, do share it, and do subscribe to my channel for the more updates related to medical coding. Thank you.